Well, thank you for joining me today for episode number 16 of the Healthy Skeptic MD podcast. I'm Dr. Michael Hockman. Today will actually be the last episode of 2020 of season 1 of the Healthy Skeptic MD because I'm going to take a couple weeks off for the holidays. I hope everybody has a nice holiday break as best as possible during the current time with coronavirus. I'll be back on January 8th in the new year, and we'll be kicking off a second season. We're going to focus in that season on key medical decisions, as I mentioned last week. So I have some really great upcoming guests about addressing issues like, should I take a daily cholesterol medication? What are the pros and cons of a daily glass of alcohol? What about hormone therapy, and questions such as those? So the last few weeks, I've had Dr. Peter Cohen talk about the clinical presentation of COVID-19. Last week, Dr. Jessica Hockman, my wife, talked about COVID-19 in children. And this week, I have Dr. Jay Bhatt to talk about COVID-19 in the elderly. Dr. Bhatt is a pediatrician, a great guy who I did some of my medical training with at the Cambridge Health Alliance in Massachusetts. Until recently, Jay was the chief medical officer of the American Hospital Association. He's also been a correspondent for ABC News, and he's been an advisor to the Joe Biden administration. So very accomplished person, and also happens to be a great and articulate geriatrician. So stick around for the interview with him. Now, if you do find today's conversation intriguing, please do subscribe to the Healthy Skeptic MD wherever it is you listen to podcasts. You can also subscribe to the Healthy Skeptic MD YouTube channel. Please also pass along the podcast to any friends or family who might be interested. I really appreciate your help getting it out there, and also would appreciate if anybody has time to take a minute and leave a review. I think it really helps to get the word out there about the podcast. Now, before we jump into today's interview, as always, I'll do a brief rundown of the health news of the week. And of course, this week it's been dominated by the vaccine. I've been getting a lot of questions from my patients about who should and should not get the vaccine. So I'll briefly tell you my thoughts on that. First of all, overall, as I've mentioned before, I find the data very encouraging, 95% effective. That means it would reduce your risk of coronavirus by about 95%, which is really, really impressive. Also very encouraging, there have been no major life-threatening side effects apparent, although there have been a number of annoying side effects like some fevers and body aches and those sorts of things, so do be prepared for that. But the groups that I have really recommending caution in my patients are, first, obviously children under the age of 16, and in fact, the vaccine has not been authorized for children yet, so we'll have to wait for more data on kids. Also, those who have had a history of severe anaphylaxis reactions. Those are body-wide systemic reactions that might require an EpiPen, for example, maybe has some breathing problems. There have been a couple people in Britain and then one today in Alaska who have experienced those anaphylaxis reactions. So I would really urge caution and strongly consider not getting the vaccine, at least right away, and certainly not do so except in a monitored setting where an EpiPen is present if you do have a history of serious anaphylactic reactions. And to be clear, I'm not referring to minor allergies like a little bit of a rash or hay fever, those sorts of things. I would also be very cautious in pregnant women. The FDA authorization does permit use of the vaccine in pregnant women, but it has not been extensively studied in this population, so I would certainly check with your obstetrician and maybe urge caution, wait for a few more people to get it before jumping in. And also both the Pfizer and the Moderna vaccine. We just got data on the Moderna vaccine this week. There have been a couple cases of Bell's palsy. That's some facial weakness. It's an autoimmune facial weakness that can occur. If you've had a history of Bell's palsy, I probably would err on the side of caution and not get it quite yet until there's more known about that side effect. But it's not listed as an absolute contraindication, meaning you are eligible to get it according to the FDA authorization. Finally, I thought I would end on a fun editorial that I came across in the Washington Post this week. It was written by three professors, Joseph Allen, Charles Haas, and Lindsay Marr. The title of the op-ed was, We are over cleaning in response to COVID-19. Those of you who know me know probably why I'm not a big fan of cleaning, as my wife can attest to. I've been waiting for someone to write this. The authors of this article highlight that there has not yet been one documented case of COVID-19 transmission from surfaces, meaning people touching infected surfaces and then touching their body. Mainly it's spread by those respiratory droplets through the air between individuals. So probably, and I'm not saying stop cleaning, do the simple things, wash your hands, clean off surface and so forth, but we don't need to go crazy on cleaning. And I'm going to pass that one along to my wife as well. So with that, happy holidays, and let's jump into our interview with Dr. Bhatt. All right, so welcome to the show, Dr. Jay Bhatt.
Great to be here. Thank you so much for having me, Dr. Hochman.
And maybe just to begin with, why did you become a geriatrician?
So, it was a really interesting trajectory. I was a second-year resident, and one of these patients that I took care of overnight and into the next day, she's an older woman in her 70s who had come in for chest pain and difficulty urinating, and we, got her all taken care of up to the floor. She's there overnight. She's getting better, and then we do rounds and see her and 20 other patients the next morning. And then several hours later, one of the nurses comes to me and says that Mrs. K is on the floor on her left side in pain. Turns out that she had gotten tangled on her telemetry wires that monitor her heart rhythm and her Foley catheter that had helped her urinate, and she had broken her hip. And then I had to get surgery, and then went to post-acute rehab, and then got an infection in post-acute rehab, and then came back to the hospital. And so what would have been an in and out quick stay turned into a 3-week ordeal. And through that process, I saw the impact a continuum of care, geriatricians, paying attention to quality and safety, looking holistically could make. And this is also someone that didn't only have physical suffering, but had mental suffering. She was afraid, she was anxious, she felt alone. And so when we think about geriatrics, it's the complexity. It's taking a number of different puzzle pieces, bringing it together, and trying to help people live at the best level of health they can within their context. And so I just think that not only are they rewarding to take care of, they also can be funny too. I remember I walked in my geriatric fellowship in Michigan, take care of a woman, and I said, "How did you sleep last night?" She said, "On the mattress, doc." And they've got this sense of humor that keeps you honest.
Well, I have to say I'm a general internist. I'm not a geriatrician. I've had some of the similar perspectives, though. There's some of the best insights of any patients. I learned the most from them. And also similarly, during my training, I often felt like, are we really doing more benefit than harm? When I saw the harms that we would do from them, as you said, with the telemetry and other things in the hospital. One other thing I should mention briefly is that I was, believe it or not, despite the fact that Jay is now was all these very high-ranking positions, I was his supervising resident when we were in training together. So that needs to be said for the record.
Well.
That's right. So,
and I remember the late night 5-minute instruction sessions, and I'm so grateful. I'm a better doctor, better professional, better human because of the opportunity to work with you, and it's great that we get to continue working together. And I think that what you point out is that I think geriatricians and internists, that are invested in underserved, vulnerable populations are caring, compassionate, devoted, and they want to work with a team. And we're just bringing the team together to make a difference.
Absolutely. So Jay, of course, we're going to spend most of the time today talking about COVID because that is the topic of the time. But before we get into that, one other thing I need to ask you about the Bongra dancing. You've started classes for patients on Bongra dancing. Tell us a little bit about what that is and why would you do it with your patients?
Sure. And I had this experience in Boston when we were training together. Our community, we took care of a lot of Portuguese population, people from Brazil. So I had taken care of a Brazilian man who was having kidney disease and kidney failure. And he just really was out of spirits. And I felt like there was a lot of joy and life in this man. talking to his family and understanding kind of his day to day. And so I just thought, heck, I might put my iPhone next to his ear on the pillow, play some music, and just dance for him and see if that lifts his spirits. And it did. And he had brought this smile to his face. And so I kept doing it. And it just got better, and to the point that he was moving around too. I mean, he was bringing his sort of Brazilian music and experiences, and then his family was there. And so it just became this really important thing that brought life and connection and healing. It was sort of the other magic tool that I didn't know I had. I mean, I'd grown up dancing and loved music. And so he coined me the term the dancing doctor. And so that really led me on this desire to try to teach a group of patients. And if you remember, outside of Somerville Hospital, they used to do the street fest in the summer. So we actually got a bunch of people dancing there. And so I brought that, teaching some of my patients from clinic in Boston, and brought it to Chicago, where not only people from the community who wanted to learn dance, but they could side by side be dancing with someone who was just in my clinic that day or that week. So it was a group of 15 patients and 10 or so other folks from the community, and just became a really important way for not only connection, but people found a ride to their next colonoscopy appointment, or someone that had experienced breast cancer and help maybe save someone else's experience, that so it wouldn't be as tragic. And a homeless man who found some refuge with someone that cared about taking care of that population. So, not only was it about physical activity and exercise, but it was about connection and emotion, and which is so important to health.
Yeah, well, a couple weeks ago, we had on this show Sachin Jain, who's another physician, actually, who both Jay knows as well. And he talked about this idea of radical common sense, all these things that just seem so obvious in healthcare. And just a dancing class with your patients is one of those. All the health things that come out of it, the social networking, the psychological benefits. And as you said, patients learn, I can get my breast cancer screening, and you learn from the stories of other patients. So I just thought it was a great idea that you started. Okay, so let's shift to COVID. We've talked a little bit. We've had Dr. Peter Cohen talk about COVID-19 in general. I had a pediatrician last week talk about COVID in children. Tell us, how does COVID-19 typically present in older individuals?
So COVID-19 can be really difficult for older individuals, and for some, it might not affect them as much. It depends on what other health conditions you have, what your health status is, who you might be exposed to. But I think, one, people that have comorbidities, chronic diseases, are obese, have diabetes, COVID seems to affect them in a much stronger way. People with lung disease, people whose immune system can be challenged, autoimmune condition. So it affects them in that way, and the disease progression can get accelerated. And then there isn't just sometimes enough immune power to help fight the virus, as it is with older adults. And so that's why we talk about protecting and staying away from them. And while we've been just so thoughtful and careful about being around older adults during this pandemic, the other is psychologically and from a mental health perspective. Social isolation can be really difficult. I think that older adults crave connection and need it, in fact, in order to have health. And they also need some support. They're older adults that may not be able to get food on their own, or may not be able to do activities of daily living, and need support, and they might not be able to get that. And that's been really hard for some families. And then those are in nursing homes and long-term care, who we know where infection is easy for those folks to have experience with, and they could have other conditions that might make it hard for them to fight the virus and recover.
Right. So as you said, it's sounding like, unfortunately, older individuals are some of the most susceptible to the complications of the virus itself. But also, as you said, sadly, they also seem to be most susceptible to the psychological and mental health effects of our response to the virus. certainly something I've seen, that older individuals are those who are suffering the most from the social isolation. Um, could you talk a little bit more about what you've seen as a practicing geriatrician in your patients?
Yeah, I've seen that the pandemic lockdown, some of the measures that have been taken that have been important measures from a prevention and public health standpoint, has taken a toll on some of my patients that I've seen, both in the outpatient clinic as well as in nursing home and long-term care. And in fact, the challenge has been not being able to see their families, not being able to see their loved ones, but they've been adapting through using their iPad or Zoom or virtual or FaceTime. But not all older adults may have the faculties to be able to do that. I've seen patients in their 70s and 80s who actually are following some of the mitigation measures, masking, not having their family members come see them, getting help with groceries. And, for our vulnerable populations we take care of, for in some states and more states over the course of the pandemic, people have been able to get food delivered and digitally, again, literacy, broadband access, the ability to do that is variable across the country. But it's been really challenging, and I'm really excited about the vaccine as it comes to long-term care and nursing home facilities, for really those folks to get that. But again, it's not a substitute for the things we know work: masking, distancing, and hygiene.
Yeah, so I definitely want to come back to the vaccine in older adults, but I'm just going to ask you a question I've been getting probably a dozen times this week from older patients of mine. Rates are surging. They know they're susceptible to the virus, but they really want to see their family for the holiday season. They want that grandchild to visit. They want to go cross country. How do they balance the risks and benefits of travel during this high risk time?
Yeah, it's really tough, Mike. It's I want to see my grandmother, who's literally 30 minutes away, but I'm not going to. And I think one, we got to acknowledge that there's such an incredible desire for families to be together and for older adults to have connection with their loved ones and with that grandchild who means so much. But unfortunately, for people like them, holiday gatherings can be really a recipe for creating the environment for further spread. So I would say, we need to make individual choices, and they need to look at the risk of putting themselves in a situation where they can be exposed. My advice would be use virtual capabilities, use the telephone as best you can. This is just one holiday that unfortunately we're going to have to think just very differently about. And if you are in a situation where you know what the status of your family member is, traveling is harder. If you're going to travel somewhere by car or plane, that increases the risk. And in some of these communities where the community spread is high, just going to visit people within the community, the risk is high. And you don't know who else, your family member might have seen in the time between you last seeing them and seeing them again, or maybe even seeing them for the first time. So I think, you don't have to cancel things. You have to do a modified version of it.
Speaking of modified versions, what about outdoors with both parties wearing masks more than 6 feet apart? Is that something you'd feel comfortable with your grandmother?
Yeah, I think in places where the weather conditions are appropriate and tenable, then you certainly can do that. But it's just one more action that potentially puts your loved one at risk. And if you're in the same neighborhood, if you live not too far away and you're distancing, it's again risk tolerance, what your individual risk tolerance is.
Well, I do want to talk about the vaccine. The title of the podcast is The Healthy Skeptic. I tend to be hesitant in general about new technologies, including vaccines. But for the general population, what I've said is this one really is a home run. 95% effectiveness, no major serious adverse effects. I would have been really at a loss for what to say if this had proved to be 55% effective, and there were some safety concerns. But this really does, for the general population, seem to be effective and safe at a broad level, at least from what we know now. But what about older adults? Their immune systems are maybe not quite as responsive. Maybe the benefits won't be quite as high. What do we know so far about the vaccine in older adults?
Well, I think Dr. Hockman, you said it right, that what's exciting is that we've produced a vaccine by the marvel of science, the hard work of those that helped produce it, and those that volunteered to be in the clinical trials, young and old, to learn, what might happen, and great effectiveness. I'm actually very encouraged and excited. I think it's a game changer, but it isn't the only thing we need to continue doing. I think regardless of the vaccine, we need to continue masking, distancing, hand hygiene, and thinking about risk. I think older adults can take it. It's been tested in those populations. And of course, the first wave of vaccines are going to go to long-term care and nursing homes. But then after essential workers, which are likely the next wave, the wave after that will likely be older adults. And I think folks have to pay attention to the guidance that their state gives them in terms of their ability of when they can take the vaccine. Now, the mRNA, which is a new technology and a new platform, has great results, and you're going to get a number of other viruses out in next year in Q1 and Q2, and I think that'll just be better news. And I think in New York, for example, in communities that have been hard hit by the pandemic and have high community spread, they might get the vaccine first.
So you mentioned you have a grandmother who lives close by. Do you have any concerns or hesitancy about her getting the vaccine when it's available for her?
No, I think when it's available for her, I would encourage her to get it. In fact, show her my picture and video of when I get the vaccine, which should be shortly here. So, I think that I think it'll be good for not only our loved ones and for individuals, but for their families and for the community to have the vaccine and continue doing the things we know work.
Great. Well, very, very helpful to hear and reassuring for those of us who have elder family members or friends or who might be eligible for the vaccine. So in addition to being a practicing geriatrician, you've also been a healthcare leader. You worked previously for the Department of Public Health in Chicago, and most recently you were the Chief Medical Officer of the National American Hospital Association. So you worked with hundreds of hospitals around the country. And one of the big initiatives you focused on was an age-friendly health system. So you've been working with hospitals to make care safer. For example, trying to reduce dangerous medications for patients in the hospital. What could hospitals be doing better than they currently are for caring for older adults?
That's thanks for asking that question. And just to add another component to the vaccines piece, I think the other important thing we have to say is that we got to continue to monitor what happens, and the studies that are ongoing, and the clinical trials that are ongoing, and study and looking at what happens to those that get vaccinated over the next 6 months to 12 months. So
that's a great point, because we have 20,000 people who've gotten the vaccine in the trials that have been studied, but we don't have hundreds of thousands, and we don't have them followed for months and months. So absolutely, I think it's an important caveat to keep in mind.
Right. So I'm very excited about the work around age-friendly health systems. I think it was something that was unique in the sense that it brought stakeholders that work to improve care in hospitals together. The Institute for Healthcare Improvement played an important role in providing leadership, along with the John A. Hartford Foundation, the Catholic Health Association, and the American Hospital Association. And the model is organized around the notion of the 4 M's: medications management, which you alluded to, mentation, so your cognitive thinking, mobility, the ability to make sure you move around and not get deconditioned and fall and develop ulcers and pressure sores, but also what matters to you, which is really around patient and family preferences. And I think hospitals and health systems have made a lot of progress on quality and safety since the report To Err is Human came out, and the reports we've had that have outlined some of the challenges of safety in hospitals. And this is really another opportunity to continue to drive forward high quality, safe care, better, smarter, safer health system for older adults. And I think of the 4Ms as a mental checklist. When I'm taking care of any older adult or any patient, frankly, let me think about their medications. Does it create problems with their cognition and their ability to think? Will it cause them to have difficulty moving around or cause them to fall? And what does good care look like for the patient? What do they want to do in the next 6 to 12 months in terms of their lives and orienting their care around their life goals, which are also connected to their health goals? So I think a high reliability health system that helps reduce errors, improve quality has been an important pursuit. And I would say equity, which we're hearing more about through the pandemic, meaning that everyone can get the same care, whether you're a man or a woman, whether you're black or white, whether you're from a rural place or a city, it shouldn't matter. And so health equity has been critically important. And I think it's, quality and equity are two sides of the same coin. And that we got to think about that as well in our pursuit for a high quality, safe healthcare system.
Yeah, so you mentioned the To Err is Human report. In fact, a couple of weeks ago, we had Mike Eisenberg and Linda Beck talk about To Err is Human. In fact, they mentioned the latest statistic that there may be as many as 440,000 deaths each year due to medical errors, or certainly to medically induced causes, which is interestingly probably about the same number as there will be COVID-19 deaths in this most recent year. Now that you're not the chief medical officer of the American Hospital Association, let me ask you a controversial question. Are hospitals safe places for older adults?
I think hospitals have shown that they've been places where folks have been able to get to healing, have been able to get better, but they've also been shown to be places where you can have complications and adverse events. And I think that what we're learning actually from patients and families who are part of these patient and family advisory councils that are becoming more and more of an important voice in the way that care should be delivered in hospitals and health systems. And in fact, are helping hospitals and health systems be better, be safer, and be smarter. And so I would say that we've made progress and there's more work to be done to get to that place where we can say unequivocally that hospitals are safe. They are doing everything they can. I'm encouraged, certainly in the time that I've been at the American Hospital Association and thereafter, about the actions that are being taken to ensure a high quality, safe healthcare system for the American public. And I would say that if you don't need to be in the hospital, then we've got to also continue to work hard to reduce reduce preventable admissions and readmissions. Like the story that I started with early in our conversation. And we've got to do all the things that we need to ensure that people are getting the care where they need it most, and where is the best place for them to get it.
In the coming months, particularly with the pandemic, a lot of older people are going to be in the hospital, maybe by themselves. They're not going to be able to have family members visiting them. What advice would you give to patients, and probably more importantly in this case, their family members, to keep them safe remotely when they're not able to be there checking over everything that's happening? What advice if, for example, you had a grandmother who was hospitalized for COVID and you couldn't be there to be with her? What could you do to help keep her safe and protect her from medical mistakes that could happen in a hospital?
I would try to be in touch with the care team as often as I could, and actually apply the lessons of age-friendly health systems and the 4Ms as a checklist, and just understand and say that I'm another partner, on your team as a family member. I'd stay away from the hospital as much as I could, and be able to, if I needed to be there, see my grandmother from a distance. And if I needed to go into the room, wear a mask and be at a distance. But avoid, that as much as possible. We're seeing folks again use technology, and I would I would do that as best as I could, but not everyone is able to. So I think to the extent that, we can use the telephone, you want to talk to my loved one to make sure that they feel safe, that they feel orange. So I'd call my grandmother and every day and just make sure that she heard my voice, that she heard, me suggesting ways that she could stay safe, and encourage my other family members not to visit her, particularly if, they're coming from a high risk situation.
Yeah, well, I think that's great advice. I just finished doing a month at the LA County USC Medical Center, and so many patients are there, and they don't have family members visiting them, and I can definitely sense there's a lot of frustration. People calling nurses, and the nurses are just so busy they don't have time to talk. So I've been really encouraging people to just spend some time talking directly with their family members in the hospital, just hearing the voice of someone they know, even if they can't be there in person. And I have been encouraging them to be persistent until they do get to talk. Be patient, be understanding. The nurses are very busy. It's a crazy time right now in the hospitals, but that doesn't mean you can't get 3 minutes or 5 minutes to just get the latest updates and make sure. So I think you're exactly right on that point.
Yeah, I would agree with you. I think persistence, and having patience is a virtue. I think in these times, just being understanding of how challenging it is for healthcare team members, that you got to just keep trying. And it's important to have those updates.
Well, this has been a great discussion, Jay. I so appreciate your joining the Healthy Skeptic MD podcast. This will actually be the final episode of the first season, and until the new year. So I wish everybody a happy holiday. If you did find today's discussion interesting, please do search and subscribe to the Healthy Skeptic MD wherever you listen to podcasts or on YouTube, and we'll pick it up on January 8th in the new year. Thanks for joining today, Jay.
Thanks for having me. It was just really a pleasure to be with you. And happy holidays, and be well and be safe.
Happy holidays, everyone. Thanks.